Today we'll be discussing major depressive disorder, specifically with postpartum onset, also known as postpartum depression. Some of the symptoms or manifestations you might see with postpartum depression include lack of enjoyment in life, disinterest in others, or loss of normal give and take in relationships, intense feelings of inadequacy, unworthiness, guilt, inability to cope, a loss of mental concentration, or inability to make decisions, disturbed sleep or changes in appetite, constant fatigue and feeling ill, crying for, quote, no reason, a lack of interest in the baby, or not feeling bonded to the baby, or feeling very anxious about the baby, feelings of being a bad mother, or fear of harming the baby or oneself. The DSM-5 criteria for postpartum depression is the same as that of major depressive disorder. What distinguishes postpartum disorder is the time of onset. The criteria for a major depressive episode include experiencing 5 or more of the following 9 symptoms in the same 2-week period. Each symptom represents a change from previous functioning and needs to be present nearly every day. Those symptoms are depressed mood, loss of interest or pleasure for most of the day, change in weight or appetite. For the weight, it needs to be a 5% change over 1 month. Insomnia or hypersomnia, psychomotor retardation or agitation, loss of energy or fatigue, worthlessness or guilt, impaired concentration or indecisiveness, and recurrent thoughts of death or suicidal ideation or attempt. Also, more criteria for a major depressive episode include that symptoms cause significant distress or impairment. The episode is not attributable to a substance or medical condition. The episode is not better explained by a psychotic disorder, and then there has never been a manic or hypomanic episode. What distinguishes postpartum depression is that the onset was either during pregnancy or within 4 weeks of delivery, which there has been some controversy about the timing of the diagnosis. A lot of people within the psych community believe that, and outside of the psych community also believe that it could be much later than 4 weeks after delivery that the mother experiences symptoms of postpartum depression, and this was not updated in the most recent update of the DSM. So for now, that is the criteria, is that the onset is during pregnancy or within 4 weeks of delivery. Different medications you might see for postpartum depression are the same as those of a major depressive disorder. One classification would be SSRIs, or the selective serotonin reuptake inhibitor. So those block the reabsorption of serotonin in the brain, making more serotonin available in the body. And a lot of these medications, people recognize the trade names. There's lots of commercials and they hear about them a lot. So some of those medications include Prozac, Zoloft, or Paxil. Another classification would be SNRIs, or serotonin and norepinephrine reuptake inhibitors. Those block the reabsorption of serotonin and norepinephrine in the brain, making more available. And medications for those include Wellbutrin, Effexor, or Cymbalta. And lastly, you might see MAOIs, or monoamine oxidase inhibitors. So it inhibits monoamine oxidase, which is an enzyme that removes norepinephrine, serotonin, and dopamine from the brain. And those medications include Nardil, Parnate, or Abilify. Next, some therapeutic communication strategies the nurse might be using include offering self. So the nurse offers their time and attention to the patient, especially following delivery. A lot of the attention is on the baby, and so the nurse can give the mother the attention that she needs following delivery. Also making observations. So the nurse should be observing for signs of postpartum depression following birth. Also, when the mother brings the baby back for checkups, the nurse should be observing the mother for any symptoms then as well. And also giving broad openings. So if postpartum depression is suspected, asking the mother what's on your mind, to get them talking. Um, she just may not have had someone ask her what's wrong, so getting her the opportunity to talk and just discuss anything that's wrong with her. Some of the diagnostic tools for postpartum depression include a depression screening questionnaire, and there are specific ones for postpartum depression. They will also check the thyroid levels, just to rule out hypothyroidism, as it has a lot of the same symptoms as postpartum depression. And again, the onset occurs during pregnancy and looking up to 1 year following delivery. Something to note is that new mothers also experience the baby blues, which is different than postpartum depression. You do see a lot of the same symptoms with the baby blues, such as irritability, anxiety, restlessness, crying for no reason, sadness, or being impatient. The difference, though, is that these symptoms will go away. And also with postpartum depression, uh, it's very debilitating for the mother, and she can't function as she would have before the pregnancy. As far as the impact on the quality of life, postpartum depression has a major impact on both the mother's quality of life as well as the child's. Primarily, postpartum depression affects the mother's day to day life, but also leaves an impression with the child as well. The mother's life has completely turned upside down with the introduction of the baby, and on top of that, she is suffering from symptoms such as mood swings, loss of appetite, lack of sleep, besides what is expected, overwhelming sadness, or possibly even suicidal tendencies. With the birth of a child, the expectation is for the mother to care for the child and provide the child with basic needs. If the mother is experiencing the symptoms associated with postpartum depression, she may not be able to fulfill the basic needs of the baby, and in turn, she feels like a bad mother, which just fuels the depression even more. Not only will she feel like a bad mother, but outside people may be judging her for her lack of parenting, which also does not help the situation. The mother may also not recognize the fact that she is experiencing postpartum depression and therefore does not seek help, which could extend the episode even longer. Postpartum depression in the mother may also have a significant impact on the child's development. When the child is young, they require physical touch to help them develop their regulatory skills and their ability to cope with stress. If the mother is detached, the child is twice as likely to develop psychological issues later in life. Because this has such a major effect on both the mother as well as the child, there needs to be more awareness and education regarding postpartum depression. Pregnant mothers or those trying to become pregnant need to be made aware of symptoms to look for in regards to postpartum depression, but more importantly, to seek help. We have to work to break the stigma surrounding mothers and postpartum depression so that they can speak openly about it, get the help that they need, and ultimately have a loving and nurturing relationship with their child.